touching hearts and strengthening lives since 1904. Bethesda Lutheran Homes and Services Incorporated provides supports, resources, and worldwide outreach to people with developmental disabilities.
Handling medication is an important part of your job. Your role may include providing a physician with information about allergies or current medications, assisting someone to take their medications, or monitoring for side effects or adverse reactions. Whatever your role, you are responsible for ensuring the safety of the people you support. Whether you are taking medication yourself or assisting another person, you have the responsibility to know about the medications being given. Many of the people you support will need prescribed medications, which you may not be familiar with and can be potentially dangerous. Medications are useful, but medications that can help heal also have the potential for harm if they aren't taken safely and appropriately. For example, health can be endangered by stopping a medication regimen too soon, missing prescribed dosages, or by taking certain medications together. Any medication can be harmful, even vitamins, stool softeners, or pain relievers like aspirin or Tylenol. Medications come in many different forms. Some forms include tablets, drops, ointments, injectables, and skin patches. There are various factors in determining which form of medication will be used. Factors include the speed at which the medication is needed, the area of the body the medication will act upon, chemical properties of the medication, the age of the person taking the medication, and the person's medical history. Medications are introduced into the body by a variety of routes. Some medications can be given by only one route because absorption for maximum effectiveness occurs by that route, or because the specific substance is toxic or damaging when given by another route. Some examples of routes of medication include oral, topical, transdermal, inhaled, rectal, vaginal, eye, and ear. When assisting someone with medication, you must always follow good infection control practices. Good infection control practices include washing your hands before and after each person you assist, and have the person you assist wash their hands. Clean any surface areas where medication will be taken. Do not use the same equipment between individuals without cleaning the equipment first. Try to use disposable items as much as possible. Always wear gloves if there is any possibility that you may be exposed to body fluids, or if there is the potential for you to absorb the medication that comes in contact with your hands. Never return dropped medications to the container. Medications that have been removed from their container or dropped should be disposed of by following your agency's policy. If you need to handle medications, do not handle them with your bare hand. Always use gloves, a spoon, tongue blade, or medicine cup. Only the person receiving the medication should handle them with their bare hand. There are two ways to assist a person in taking their medication: supervising or administering. Supervising is to coach and observe the taking of medication. This means the person takes their own medication with minimal help from staff. Staff may assist people to open the medication packet if they are unable to. Administering medication means to actually give the person the medication. Staff administers medication only if the court has determined that the person is not competent to administer their own medication, or the doctor has given an order for the administration of the medication by staff. This may be ordered because of physical or mental disabilities that make it difficult for a person to administer the medication on their own. Always encourage people to participate to the fullest degree in order to help them achieve the greatest amount of independence. Dispensing of medication is done by a pharmacist. Removing medication from one package and putting them into another is dispensing. You should never dispense medication. Follow your agency's policies and procedures in regards to dispensing medication. Medications are divided into two main categories: prescription drugs and non-prescription drugs, which are also known as over-the-counter medications. Prescription drugs include all medication that must be prescribed by a physician and dispensed by a pharmacist. Examples would be antibiotics, anticonvulsants, and psychotropic medication. Prescription drugs can be broken down into two subcategories: controlled drugs and non-controlled drugs. Most medications are not controlled by regulations. However, because of the high potential for abuse, some medications are regulated. These are called controlled drugs. The most common controlled medications include Valium, Ativan, Tylenol No. 3, and phenobarbital. Non-prescription or over-the-counter drugs include any medication that can be purchased without a prescription. Examples of over-the-counter medication include aspirin, ibuprofen, cough syrups, and medicated shampoos. Many states require community-based services to have an order for the over-the-counter medications. Contact your supervisor to find out your agency's regulations regarding over-the-counter medications. Some medications can have a paradoxical effect. This means that the effect of the medication may be the opposite of what you want to happen. For example, Ritalin is a central nervous system stimulant which causes excitement, and yet when given to children with hyperactivity, it helps to calm them down. This effect may also be seen in people with developmental disabilities. Medications are given to produce a specific response from a person's body. Unusually high doses or lower than normal doses of medication may be required to achieve the desired effect. Remember, though, the goal is to always give the medication dose at the lowest possible level that is still effective for that person. In most cases, medication produces a specific desired response. It is what we want the medication to accomplish. For example, eliminating a headache with aspirin or reducing seizures with Dilantin. However, sometimes unplanned effects, also known as side effects, develop from taking medication. For example, an aspirin taken orally is very beneficial for treatment of headaches, but tends to irritate the lining of the stomach. It is important that you are aware of any potential reactions and side effects of the medications people are taking, and that you document any observations. Medication side effects may be difficult to identify, especially if the person does not communicate well. The person may not realize that something is abnormal, so they may not tell you. You must be observant of all behavior as well as physical changes. Being aware of a person's normal behaviors will help you to determine what behaviors are not normal for them. If what you are observing appears to be life-threatening, immediate action must be taken. Follow your agency's policies for reporting your observations. The person's record is an important document that provides proof of the care and services that a person receives. The Medication Administration Record, or what is commonly called MAR, is the document that is used to verify that medications were taken or that treatments were done. Accuracy is important to maintain quality of care. The person's medical condition, services provided by the agency, and all scheduled or PRN medications need to be recorded in the person's medical record. PRN is a Latin term for as-needed medications. Whenever a person's medical condition changes, their medical record must reflect this. A record of receiving and disposing of all medications must also be kept. There are general guidelines to follow when recording someone's medication. First, medication documentation needs to include the name, drug, dose, date, time, and any change in the person's condition. Second, make sure you are familiar with all medications and the abbreviations. Only use abbreviations approved by your agency. Always use a ballpoint pen rather than felt tip pens for documentation. Also, never use a pencil when documenting because anything written in pencil could be erased. Always write neatly and legibly. everything you document has to be easy for others to read. For each medication given, your initials must appear below the correct date and opposite the medication given. Never use ditto marks when documenting. Your initials and full signature must be found in the appropriate space on the medication record. Do not use correction fluid or what is commonly called whiteout. If you make an error, do not erase. Draw one line through the mistake, initial it, and write the word error on the line. Then document the information correctly. Remember to always record medications and treatments immediately after assisting someone. Documentation is not complete until it contains your initials. When giving a PRN medication or withholding medication, document the information and the reason on the back of the MAR. Not recording the results of PRN medication is a common mistake people make. Depending on the medication, you should check with the person within 30 minutes of them taking the medication. This is extremely important so that the effectiveness of a medication can be tracked. Document this information according to your agency's policy. The 6 rights of medication administration are essential to taking medication safely. The 6 rights include the right person, right medication, right route, right time, right dose, and right documentation. We have already talked about the right documentation, so let's go on to discuss each of the other rights. The first right is the right person. Always identify the person you are assisting. Is the name on the medication container the same as the person you are about to assist? Is the person you are assisting the same as the name on the MAR? The right medication. Give medication only from labeled containers. Be aware that there can be different names for the same drug. Be sure that the label on the medication container corresponds with the MAR. The right route. What is the medication and how is it to be given? Recheck the label on the container and MAR. The right time. As a general rule, medication should be given within 1 hour before or after the time designated on the container and MAR. Give the medication as close as possible to the stated time. Check to see if an oral medication should be taken on an empty stomach or with food. Times may need to be adjusted to avoid or coincide with meals. The right dose. Be sure the amount the person receives matches the amount stated on the container and MAR. Recheck any dose that you feel is wrong. It is important to follow the 6 rights of medication pass to help eliminate medication errors. A medication error is the administration of medication in a way other than what was prescribed and can result when one or more of the following occurs. The wrong medication is taken. The medication is taken at the wrong time. The prescribed dose is not given. The correct route isn't used. Medication is given to the wrong person, or the medication is not given at all. There are several steps you can take to help prevent medication errors. First, make sure all packaged medications remain in their packages until the person is ready to take it. Never record medication as being taken before it is actually taken by the person. Don't become distracted or leave medications unattended. Do not give a medication that has been prepared by another person or prepared ahead of time. Do not give a medication unless there is an order from the healthcare professional. Do not crush, cut, or put a medication in food without checking with the pharmacist or prescribing practitioner first. Do not use a medication from an unmarked container. Do not use medication that has changes in color, texture, odor, or consistency. Proper storage of medication is essential to maintain the quality of the medication. Medication storage areas should have enough space so that the medication can be set up and given without crowding, enough light so that labels and medication records can be easily read, cabinets that are large enough to hold medications on hand in an orderly fashion, separate locked or double locked storage for controlled drugs, a labeled and locked storage container for medications that need to be stored in the refrigerator, separate shelves or containers for oral and external medication, and an area with little humidity. Moisture can damage medication, so bathrooms or kitchens may not be a good place for storing medication due to the level of humidity. Medications should be checked on a regular basis. Medications that appear to have something wrong with them or have expiration dates that are past should be disposed of per your agency's policy. The following are general guidelines for checking medication. When checking liquids, check for any unusual color or thickness, particles that are on the bottom of the bottle or floating in the solution, clarity of the liquid, and any strange or different odors. When checking tablets, check to see if the appearance has changed. Is there any odor? Are all the tablets the same size and thickness? If imprinted, do all the tablets have the same imprint? Capsules should be checked for dents or cracks, shiny or dull appearance, size, color, or unusual odors. Ointments and creams should be checked for firmly sealed tops, holes or cracks in the tube, smoothness and separation of the medication. Medications should be kept and stored in their original containers. Well-closed containers protect the medication from outside contamination and loss of potency. During storage, caps and lids should be properly maintained and tight. Well-closed containers are the means to protect the medication. Temperature directions are put onto the medication label if a higher or lower temperature is needed to prevent unwanted effects on the drug. When the medication label tells you to refrigerate, the temperature should be between 36 and 46 degrees Fahrenheit. Most medications are stored at room temperature, which is between 59 to 86 degrees Fahrenheit. A doctor's order for services must be in the person's record. Examples of such orders would include any treatments or medications that the person takes, whether the medication is prescription or over-the-counter. Any rehabilitation services the person uses. This usually means any need for physical, occupational, or speech therapy. Special therapeutic diets, which could include diabetic diets or foods that need to be chopped or pureed. The physician may write a prescription that you may take to the pharmacy, or the physician may phone or fax the pharmacy with the order. Never accept an order from the doctor over the phone. The only person who should take an order from the physician over the phone is a pharmacist or nurse. Ask the doctor to send or fax you a copy for your records. When you receive a physician's order, make sure that you and the person you support understand what the medication is, why it is prescribed, and exactly how the physician wants a treatment done. Make sure you are able to read and understand the order. Ask the physician for clarification for anything you can't read or understand. Ask questions if you or the person you support has any other concerns about their health. There are many reference sites on the internet for the most current information on medication. Whenever checking for medical information on the internet, verify that the source is reliable. No two people are exactly alike, and no medication affects everyone in exactly the same way. Responses to drug action differ according to the person's age, size, gender, genetics, and physical and emotional conditions. These personal characteristics may cause slightly different drug reactions in different people who receive the same medication. The route of administration, dosage, the number and size of the dose, the person's diet, and environmental conditions can also play a role in deciding which drug and how much to prescribe. Physicians take all these factors into consideration before deciding which medication to prescribe. With proper administration, a medication usually has the desired effect and the person feels better. Assisting someone with medication requires both the knowledge of the medication effects and observations of the results in the person. With your help, the people you support can lead a richer and healthier life.